It's your village girl, Dr. Ndouvhada, and welcome back to the Doctor's Corner podcast. This is a medical podcast where we have health conversations, real conversations, and we have experts that come and give us advice. And I am your host. So today's topic is how is unemployment affecting our mental health as youth in South Africa? And joining me is someone that has the expertise and also has personal experience. She's a medical doctor, and most of you might know her on the big platform of Miss South Africa. And that is Dr. Moratwe Masima. Dr. Moratwe, welcome to the Doctor's Corner podcast.
Thank you, Dr. Dakalo. Thank you for having me.
I'm really excited to have you here. Myself, I've been a supporter of you from day one. And we might think that we know you, right? And it's important that you give us your introduction. Tell us who you are, what you do, what you're about. You can introduce yourself.
Okay, so my name is Moratwe Masima. I'm a medical doctor born and raised in Johannesburg with family roots in Matatiele in the Eastern Cape. I then went to Stellenbosch University to obtain my bachelor in medicine and surgery, and I graduated in 2020. And currently, I'm a family medicine medical doctor, and I basically work in primary care, and I really love it. On the side, as you've mentioned, a lot of people would know me from South Africa. I call myself a driven dreamer. I'm somebody that really immerses myself in different things. And I think that it's given me a platform that has shared my story and shared the journey of being different as a doctor, but also being intentional.
Well, but... one of the things that I saw from your platforms, you have always been vulnerable with us. You've always shared your experience. I think that's why people gravitate to you a lot. One of the things that you spoke about was unemployment. When you spoke about unemployment, we were still in the journey of like, I'm going to be employed. And no one was talking about the unemployed part, right? It might not just be doctors, but there's like a lot of people that are going through unemployment and they feel unseen, right? Myself, I have experienced that. I know how it feels like, but I don't know how was that period for you of unemployment. If you can just like go into details and however much you are comfortable saying, it might help someone who is sitting out there thinking, oh, I can never get out of this slump. How are you doing during that time?
Definitely. So I think that for a lot of us as doctors, unemployment was really something that was unexpected.
Yeah.
I think when you choose medicine at the age of 18, especially 10 years ago when I chose medicine, it was a revered career where people said, you will never struggle. And so 10 years later, I was shocked to find myself sitting there thinking that, did I make a mistake? And I was unemployed straight out of ComServe, but I was asynchronous. So I actually finished ComServe at the end of February last year. I was about 2 to 3 months late because I participated in South Africa and it delayed me a little bit. But I would say that I sat home for about 4 months, not really knowing which direction I wanted to go into. And I think that it was quite a shock for my system and also people around me, especially my family, because they truly did not understand how a doctor can be unemployed. And because I'm the first doctor in my family, it was really just one of those things where people were questioning, how does this happen? And I think that even with yourself, your self-esteem really does plummet because you think to yourself, how did I get here? I did the right things. I followed the book. I studied for 6 years. I chose a science-related degree. I chose to, follow my passions because people and community are my passions. And I think that it really did play a part in my self-esteem. During that time, I would say that I really sat. I enjoyed the time off for like maybe a month. And then after a month, I started panicking because I think that, it was the first time that I actually rested since medical school. We study for 6 years and you do internship and then community service and you just go. But that time I allowed myself to actually sleep in. I allowed myself to do the things that I wanted to do. But after a month, I realized, okay, this is very real. I actually have no prospects and I don't know what the next plan is. And I think that when you listen to a lot of people's stories, they tell you just contact people, send your CV here, do this diploma, do your primaries. There's so many stories of you need to follow a specific path, but you know yourself and you know what you want a lot of the times. And sometimes that advice actually is quite confusing for you.
Yes.
I would say for my own journey, I felt that I had to sit with myself and ask myself what I truly wanted out of my career. And also just for my own projection, 5 years from now, 10 years from now, who is Moratwe going to be? So what's really important, I would say, is that for people to really spend the time, yes, it's really difficult to sit down, but actually take it as a blessing in disguise.
Yes.
Sit down with yourself, question what you really want for the next couple of years for your life, and not necessarily just take in the noise. I would also say that during that time, I really immersed myself in my mental health. I really took care of it. So I'm an avid... I did my diploma in mental health.
Yes.
And I'm somebody that really prioritizes my mental health. I run, I exercise for my mental health, not just for the physical.
For the physical part of it, yeah.
Yes. And on top of that, I meditate every single day. People find it weird sometimes because it's difficult to meditate.
But you just sit in silence.
I actually use rain sounds.
Oh, really?
You know what? Something about meditation is that once you've gotten to the point where you're so good at it, like you actually have to practice. It's like any other exercise.
Oh, okay.
You quieten your mind in such a way that you actually enter a zone where you feel like you're floating. I know it sounds crazy because it actually does feel like that. It does feel crazy. But I actually have mastered it. And I think that it helped me so much to stay calm in very stressful situations. I prayed a lot during the time. And I really, focused on my community. My family really held me down. And I think that they continued to remind me how I got here, that I'm worthy despite my circumstances.
Yes. So month 1, you said you rested.
Yes.
Month 2, you started thinking, I need to put down something. You know? And your family is like supporting you on month 2, 3. Month 3, when you get to month 3, like what's going on? Like, are you thinking, I'm still thinking what I want to do? Because I think for me, I was unemployed for 2 months. And I went home. My grandmother was like, saw me. It was a hot January and I was sitting. I was just feeling hot, to be honest. It was not like I was stressed about anything. But the fact that I prepared her, she was worried already. Like, I think she was worried more than I was. I just slept out. I just slept on the floor. The tile is normally cold, right? And she's like, yo, tomorrow you must pack your bags, go to your cousins. Don't stay here. I don't want people to see you in this state. I was like, oh, well, okay, I'm going to go. I left and I went to stay with my cousins. They were very supportive, right? They would like, one of my cousins worked from home and the other one made sure that when the other one is not there, like they were like babysitting me, right?
Yes.
And when it was January, it was okay. Like, I was like contacting whoever, like, I'm ready if you want like a locum, whatever. It was okay. And I know, okay, I still have like savings for that. But when I saw February coming, I said, God, I don't think I can do this, regardless of the support I had, my mental health, like just, I found myself thinking dark thoughts. I've never been in a state, I've been diagnosed clinically depressed before, but I've never been in that ditch. And I was so in denial that I didn't want to think that maybe that diagnosis coming back. I was like, I would laugh and make jokes and we'll go for walks and hikes with my cousins. But I was like, those things come in, they revisit. I don't want to say them because I believe that if you say it out loud, you give it a life, right? So at that time, I didn't even want to seek mental health because I didn't, someone to help me. And this could be my story and it's someone else's story. You work in an environment where you're able to see mental health patients.
Yes.
How from that point of view, how is mental health unemployment affecting the youth in South Africa in general, from your clinical point of view and from what you just have seen around?
I think it's a huge, huge issue. And I think that the youth is now only waking up to how dire the situation is. I think that for a long time, we've been in denial about how bad it's gotten. until we actually cannot lie to ourselves anymore. I think in practice as a doctor, I work with mental health all day and other medical conditions. But I find that a lot of the times the physical manifestations are as a result of stress-related issues, anxiety or depression. So when you're treating a patient coming in with a chronic cough, or you're coming in with a headache that doesn't go away, I've given everything.
Yeah,
nothing
you've tried
happens.
Everything, nothing is helping.
Exactly.
Yeah.
And then you start to actually, question the psychosocial stresses in their lives. And they actually tell you that, no, actually, I'm not sleeping at night. I'm worried about A, B, and C. And a lot of the times it's either they cannot go to university because they don't have the funds for it, or they did go to university and now they're sitting at home with no prospects. Their family are looking at them, and they were the people that were meant to, elevate the family dynamic. And I think that's a lot of the story of South Africans, is that we were sent to university to make a change in our families.
Yes.
And when you can't do that, it really takes a toll on your mental health, and it manifests physically.
Physically, yeah.
So what I would say is that I like to be a holistic doctor. I'm one of those people that really like to take a proper history to understand what has led you to see me. A lot of the times it's not just physical. And so, as I would say, I like to refer my patients to a psychiatrist or a psychologist, especially when I see that they are struggling with physical symptoms of anxiety. A lot of the times this is panic attacks, chest pain, shortness of breath, even, as I said, the persistent headache that doesn't go away, and feelings of anhedonia. Anhedonia is just the loss of joy.
Yeah.
So basically, anytime you don't feel like doing the thing that made you happy, if you loved drawing, cooking, and you no longer want to do that, that is a marker of depression. And so I usually start with psychological help. We, luckily in the public health system, we do have referral systems where we send patients to the social worker or send them to a psychologist. That is the first line of defense, as I would call it. Then if that doesn't work, psychotherapy doesn't work, then they come see me again and I start some sort of medication. But I always tell my patients, I don't like people to just depend on medication, because a lot of the times mental health really does require you to do the work. So we work with the medication, with psychotherapy together, and lifestyle modification. So this is a big thing that some people don't take into account. We talk about blood pressure, we talk about diabetes. People understand that if I start exercising, things will be better if I change those things. But when you do exercise, you are increasing your serotonin levels, you're decreasing your cortisol levels, which in turn change the way your mental health is, your general state. Yes. And I really implore people to seek the help, because the help is there. It's difficult. I can't lie. I have taken a long, long time to even sit in a therapist's chair. And I took myself to therapy for the first time this year, not out of actually needing to fix anything, but I knew that this was something I needed to do for myself and for my future self as well. Because at the end of the day, if I'm not well for my patients or for my family, no one else is going to be there to save me. And a lot of the times you just need to sit with yourself and say, do I have someone to speak to? And as a doctor, we see so much, so much. And I think that I actually do get affected by my patients. And if they don't do well, or if a patient demises in front of me, I am affected. And that's what took me to therapy. I needed to debrief with somebody.
Yeah. And when it comes to like the public sector, right? Not every institution has the right chains, and also the people that are there, sometimes they're not really there to do their part, because you as a doctor, you can only do this much, right? You can sit down with the patient, and the fact that doctors in public are not enough, right? If you're Dr. Moratwe, in the clinic, you have 50 patients to see. If a young person comes and then it's a headache, sometimes because of the number of people you need to see, you literally just give them whatever that the headache is resolving. But then when you see that this person keeps coming, complaining about the same things, sometimes they just needed someone to reassure them that, okay, the headache is actually coming from the stress. But that needs you a psych assessment, whether you're a psychiatrist or not, like just the psych assessment, it has to take like more than 30 minutes.
Yes.
Which as a public health doctor, a public doctor, you don't have that 30 minutes or an hour to talk to one patient when there's like 50 patients waiting for you there. I think that's one of the biggest challenges, that we do have the system.
Yes.
The system is there, but we don't have the number of doctors to patients is very it doesn't make sense.
Absolutely.
Right? That's why a lot of mental health care patients, they miss in follow-up, because the psychologist is not going to see 50 young people at the same time. Right? And we don't have things like group therapies that maybe the platforms are there, but people don't know about it. Right?
Yes, they don't.
I think, having had problems with my mental health because of the unemployment, I am more sympathetic with my patients. Like, I have more empathy with my patients. I see, okay, this is a problem, because I think where I am working right now, I'm working in private, right? Most people that come, it's chest pain, anxiety attacks, and all those things, right? But then I'm like, okay, even the young people that are in high school, right?
Yes.
I have to sit down and say, okay, what's wrong? What's going on? And the time you take to speak to that person, after that, they're like, oh, doctor, I actually don't need the headache medication. I'm okay. I'll come back next week, and we just sit, and you try to find a psychologist, and like, patients don't understand that I'm not a one-stop shop. You need a mental health care practitioner, you need a psychologist, you need a physiotherapist, and all those things, right?
Yes.
So giving people information that this is where you're supposed to go, and who's supposed to be involved in you getting better: yourself, your community. The doctor will be there, the psychologist will be there, but you also need to do the work. But then for someone who's like, I went, it doesn't work. I have been there, doesn't work. What does that stage of saying it doesn't work mean to you as someone who has expertise in mental health? What does that look like? You spoke about anhedonia, which is something that a lot of people experience. I have experienced it myself, but there's someone who's like deep down. How do you tell them that, okay, you need to come?
Yes. So there are many patients that present that way. It's either they are coming to the consultation room and you suggest different ways of coming at the treatment plan, and then they tell you, no, I've been there, especially in public, because obviously the waiting lines are so long. They can wait 3 months sometimes to see somebody, and by the time they get there, they don't get the service that they expected, or sometimes even what they deserved, because as you mentioned, we are overstaffed. Everybody in the government, especially understaffed. Thank you for
yes,
we are understaffed, especially in the public sector, and people are also exhausted. I would say, and then on the second scenario is the people that show up so in much more dire situations and circumstances. So suicidality, patient who's attempted to self-harm, and I now see them in casualty. That's usually when it's gone so far. I would say that a lot of the times what ends up happening is that you might have one bad experience with one healthcare practitioner. So it could be a bad experience with the nurse, a bad experience with the doctor, a bad experience with the psychologist. And we then lose that hope that, okay, this was my only way. And I would just advise people to try other facilities. This is my own experience as well. I had a psychologist that I just didn't connect with. And I thought, okay, psychology is not for me. Clearly, this thing doesn't work. And that's the thing. That's what I've heard many, many times. No, talking about my problems doesn't really solve it. Until I actually found somebody that I connected with. And it was somebody I did not think I would connect with. I've always gone for a certain prototype. So for example, even with my own doctors, I'm like, I want a Black woman personally. And that's just my own bias, right? It's not necessarily that the other doctors are not good. I just want somebody I want to relate to. But I took a chance and I said, okay, let me just choose somebody that is completely different to me, older than me. I don't think they might have the same life experiences, but I've actually connected with her much better than the people I thought I would. And I think that is what I'm trying to say, is that yes, it could come from a point of privilege, because not everybody can actually go out and change their doctors and go to a different facility. But I would suggest that that's one way, because not everybody's the same. If I go to one GP and the second GP, you're going to have completely two different experiences. So I would suggest that's one way of doing things. Yeah.
And like in the communities, in the rural communities, right? If you get admitted in mental health institution, right, you are immediately labeled as crazy.
Mm-hmm.
But then you are just in a very sad state that is taking you lower than you're supposed to be. That's why you're unable to see the light. You are supposed to go and seek help.
Yes.
And admission might be one of the things that you need. So depression doesn't mean that you're crazy. Everyone can be depressed, right? And you need to be admitted in a certain institution for you to get better, because the in and out might not help. You might need Dr. Moratwe to see you every day as an inpatient. And I know the facilities are not made well, but you get an opportunity to see a psychologist, a occupational therapist, a psychiatrist at the same time in like different sessions.
Yes.
And it doesn't mean that you're crazy. Go get admitted and get proper help. And I think that's one thing that people don't want to seek mental. They don't want to be admitted because they think, are you saying I'm crazy? Are you saying I'm crazy? And that's not the case, right? And we have spoken a lot. I think we must move to the next segment. Let's say, for example, someone like me, I was employed for 3 years, right? Obviously on a contract, I did internship for 2 years and I did community service, getting a salary, very nice, living very comfortably, never thinking the ending is coming and it's very soon, right? When it came, it took me by shock, right? And I think the financial stress is the one thing that was stressing me a lot, more than anything else. When you were unemployed in that time, did you... I guess we all didn't expect it.
Yes.
We had an idea. We tried to put measures in place of doing courses and applying for this and that, right? Thinking I'm going to secure a job, right? But the financial part of it, we didn't really plan that well. Maybe let me speak for myself. From someone who went through that, did you plan financially, or like how did you go about that? And if someone was sitting there in com service, they're like asking themselves, or someone, their contract is coming to an end, they're working at some company, how would you advise them to plan financially?
So I'll be very honest, I did not plan at all. I think that, I don't know what it was that made me think that it wouldn't happen to me, but I swear I just thought I will get there when I get there and we'll see what happens. But I did not plan. I should have planned, but I was already somebody that was quite a big saver in general. So even in internship and community service, I tried to keep my expenses quite low so that I could just plan for my future. And I think even from the moment I started working, I had a financial planner that was allowing me, just giving me knowledge on how to invest and saving and all of that. So that is, once again, something that I started from the beginning of working. And I think subconsciously was teaching me that something might happen at some point.
Time like that will come. Yeah,
absolutely. So I do think that I wasn't the most hardcore saver, thinking I need to plan ahead. And the reason why I say this is because I was with people that had already started applying for jobs during ComServe in July, because community service is about 12 months and most people started applying for jobs by July, August. I waited until I was finished and I have no idea why, but I just had this faith that things were going to work out for me. But I also have to say that it's also because I was somebody that had my hands in different pots. So I've never really depended only on my salary. Even from the moment I started working, I've been able to monetize my other skill sets. So I was monetizing my YouTube at the time, even working with different brands as a social media content creator. I do make money from that. And I think that maybe that's what gave me a bit of a buffer. That even when I was unemployed from my actual job, I did have money coming from, I guess, my side hustles. I would say that in terms of preparing financially for people in general, is to be realistic with your situation. I think that all of us come from different households. And this is something that I have to always remember, is that some people don't have family to fall back on. A lot of people have had to move back home. A lot of people have to sell their cars, because when you start working, we all of a sudden buy Mercs and BMWs. And I think that, you know, never compare your situation to another person and how they're surviving their unemployment period. That was something I definitely needed to do, because it can feel very overwhelming. This person is going out every weekend. How are they doing that?
Yeah.
And I think that it's so important to just, once again, focus on your own story, because some of us do have families that are dependent on us and on our salaries. Other people do not. So we're really not on the same level. Truly just look at your own situation and assess how much risk you're going to be in if you do not have a job. And I would say that this is as a youth in general, we really do focus a lot on like external validation and, you know, being seen doing things. And you forget that that person who might be looking quite wealthy could be in debt. And it's something as a doctor, just as a youth, we really need to try and stay away from, is getting into debt, trying to look good for people.
Yeah.
That is something I try to ensure, even for myself, that I don't need to keep up with anyone but just me. And that was my financial plan, was that I knew that I had other ways to make money.
Yes.
And this is a skill that you only can develop if you know yourself.
Yes.
It's so important to, you know, figure what your passions are and try to monetize that.
You said something very important. You must know your financial standing and know yourself, because Murat's situation is not the same as Dake's situation. And I think the problem is that we think, okay, we're both interns, we're both doctors, right? Or we're both the same age. And you forget that someone is not paying rent.
Yes.
You are paying everything. Also, you need to stay in DQ so you can save extra money. You can stay with your sister or stay at home. You don't need to get that apartment. You don't need to be this person that everyone says you should be.
Yes.
And I think for me, I'm thankful that my friends are never the people that want to be seen, so like when we meet, it's just we're meeting at whoever's house. We just laugh and you go home. That doesn't require a lot of spending of money and like trying to look a certain way to like the public, you know. And we have people that have real conversations with that. Hey, you need to save money. Like when you don't come from that family, you need to save money. And also the responsibilities that we have, we are breadwinners in our families. And some people, I think for me, I added expenses. I had a baby. I did the mother thing. I had a nanny and all those things. Those things are a lot. Changing your lifestyle like that is too much. Like, I think that if I didn't make those financial decisions, I would have been in a very good space financially. And my biggest stress out, it was not that I was unemployed, it was that I don't have the money until like 3 months.
Yes.
I need to have a job.
Yes.
Now, you know. And one thing that you taught me is that you need to like have other streams of income. Don't just rely on one. And I'll try work on that. If you just tuned in now and watching us, we are still on the Doctor's Corner podcast. We are discussing how unemployment is affecting the youth mental health. And with me, I have Dr. Moratwe Masima, and I am still your host, Dr. Dakalo Ndouvhada. And Dr. Moratwe, you mentioned about having other means of income. And my question is that still related to your main career as a doctor, or was that your other passions? And when did you start knowing that, okay, you can actually monetize other things?
Yes, so I actually stumbled into making money from my passions. So how I would explain that is that I started doing YouTube videos in medical school to show my journey as a medical student and the realities of it in South Africa. I thought that we didn't really have that in South Africa, and a lot of people really glamorized the career, including myself. And being there was completely different. And I wanted to showcase that. So that was the first time that I could actually see that, okay, there is a bit of money here from YouTube. It's not a lot, but for students, trust me, it absolutely makes a difference. And that was the first time I saw that, okay, you can actually make money from other means that you're good at, you know. I'm really somebody that is good with storytelling. I think that I'm good with communication skills. So that's what I tried to build my skill set in. And then, of course, I did Miss South Africa, which was a completely different platform. This is all about pageantry, and pageantry is a complicated field, I would say, because it's all about women empowerment, but a lot of people also can say it's about objectification of women. It depends on who you're speaking to. But I always went into the platform knowing that I wanted to really stand for what I was passionate about. And that was specifically sexual and reproductive health, especially in the youth, because at the time we were having very scary statistics around teenage pregnancy, the increase in STIs in South Africa. And to this day, I still see it as a doctor. And I think that that was what I wanted to utilize the platform for. And that was just the beginning, to be honest. And I think that from then on, I never really stopped with my passions. I started my NGO called Your Health, Your Dignity. And this is specifically for underprivileged communities where I speak about sexual health, I speak about reproductive health, and then it also translated into my social media. I started making videos on, topics like HPV awareness, things that people weren't really aware of. And people didn't know that HPV was one of the highest I guess the STI that spread the fastest.
Yeah.
Yes. And almost everyone has HPV. Until you test it, you don't know.
You don't know. Yes. You're right.
And that was just the beginning, honestly. And from then on, it's been something that has become a passion project, because it's not only monetary for me, it's really aligned with my values. I really believe that education and knowledge is the key for a lot of people. A lot of people don't know where to get the information from, especially on the internet, where we're inundated with so much information on TikTok, on Instagram. And I wanted to be a voice for people that were looking for information that was different, because yes, I can learn a TikTok challenge and trend, but what value am I getting? And I think that that's what I wanted to, translate, use my knowledge that I learned from medical school, and actually then translate it into the communities and people that are wanting to learn. So that has then catapulted me into a field that I would say is a medical content creator, where I work with different companies and brands. And instead of me, I would say, selling you a beauty product, I explain the properties of what is in the beauty product from a doctor's perspective.
Yes.
And I think that it aligns with me, because it's always been my passion from medical school. That's basically been what I've been doing.
So basically you used your passion of being on the media and like speaking, storytelling, and you meshed it with your
clinical knowledge.
With your clinical knowledge. And that is also paying you.
Yes.
All right. I think sometimes we were like, oh, I'm a doctor. What can I say? TikTok is for...
Yes.
I'm one of those people who think, but I don't think I can speak like that. Like I can tell people that I don't know what the regulations are, right? But you using it in a bigger platform, and people are able to get such knowledge about STIs and HPV, mental health. Like you are reaching so many who are sitting in their homes just watching you, which is something that is you making the same impact as the doctor in the community.
Yes.
Because you are in communities of people. You can be when you're Matatiela or you are in Venda. If you have the TikTok, you will see Dr. Moratwe there, which is very important. And as a medical doctor, I think what I have learned personally is that the job that we have is being a doctor, either at the clinic or at the hospital, right? And right now, because of unemployment, we find ourselves in different parts of jobs, like you assisting there, you are working there, you are helping there. You have always been doing that, but on a different way. You've been a content creator.
Yes.
You work at YouTube. That's you work at Instagram, you work at TikTok, right?
Yes.
You work at a different hospital. All those people, you are charging them for the services that you're providing, right? So for someone who has only known this, right? How do I then, what advice do you give me in terms of how do I sell myself? How do I sell my skill, right? When I'm moving from job to job? Yes.
Yes. I would say that, I didn't come here and decide, oh, this is what I want to do. It almost happened naturally. And I think that I've always looked at every single stage of my life as a launching pad for the next version of myself. So how I can say that is that after being unemployed for 4 months, I had a very short stint in private practice. I worked as a GP. And during that time, I felt like, okay, this is so new for me. But I took that time, that 2 months that I was at the GP practice, I formed the relationships with the patients that I did, and also utilized the practice to my best, abilities. I made connections with a lot of people that I think that sometimes we forget as doctors that we are meant to connect with people. You're not trying to just push a line. You never know who you're speaking to.
Yes.
You really never know. And this is why I treat everybody with the same level of respect, because
you never
honestly, yes. And I think that even in that period of unemployment for anyone really, whatever you do, whatever side hustles you come about, if you're baking in your kitchen, if you are, babysitting people in the neighborhood, some people are dog walking, all of these are skills that you are going to help you in your next journey and whatever job you're going to be getting. So this is why I reference me sitting in my res room in university talking in front of my phone, because at the time I just filmed with my iPhone 11, I think. And I was editing there and I had no idea what I was doing. But those editing skills are now helping me with my own brand campaigns. And so every single thing, every single skill that you learn in the time that you're waiting, or your waiting period, your transition period, use that time and use those skills that you're learning to assist you to get to exactly where you want to. I also want to really implore people to not feel super discouraged about the season of waiting, because that is actually the time that you're meant to be, I don't want to use the word cooking, but you're really meant to be cooking, right? Yeah. So unemployment gives you so much time. I studied during that time. I know it's not easy for everybody, because not everybody could have had the funds to, do your diplomas, do your primaries, or whatever skill set you need to build during that time. But you'll never get that time again. And I look back and now I'm everywhere. I'm working every weekend. I barely rest. But that time that I was sitting at home was gold for me to study so that I could get to this point.
You said relationships. Relationships are very important.
Yes.
I think we spoke earlier and I told you that certain people will speak for you in rooms that you are not there. When you form relationships, when you treat people well, they are able to confidently say, oh, I actually met Moratwe, she's very nice. They refer a patient to you. They refer someone, and then someone gives you an opportunity to come speak somewhere, right? Yes. They give you an opportunity to come and speak at a big event where you don't even know how big the event is, just because of kindness and forming relationships with people. It might sound like, I just need to speak to everybody, but you do. Yeah. You do, because you never know what you will learn. You never know how far this person is going to take you, I think for me, all opportunities that I've gotten till this far are because people saw me. People really saw me, and I made sure that I treat them in a way that is, when they leave my room, they will think about it. So thank you for reiterating that relationships are important. From relationships, it will be easier for you to be able to even negotiate, to be able to say, oh, actually my rate is like this. I work this way. You confidently say no to things that that people are not treating you well, and they are not doing the right thing. Because I asked Murat, how much do you charge for whatever? How is your rate? Or if someone comes with an opportunity like this, sometimes you just say, I will do it for free. No, you must be able to speak for yourself. But those are skills that you don't just get while you're sitting there. It's skills that you get from asking people and listening to what other people are saying. You recently walked the stage of the College of South Africa. And you walked. I said, you really walked. She said, there's a stage I've walked in, which is Miss South Africa, and I'll keep walking. On that stage, when you walked and you got those 2 diplomas, I asked myself, I said, this lady, I saw her a few months ago saying I was unemployed, right? And I was like, okay, when I was unemployed, I couldn't even read something. I couldn't sit down and read a novel, right? How did she do it? How did you find motivation during that time to study such 2 big diplomas, right? Someone might be asking, Moratwe, how did you even do it? Is it allowed for you to write 2 diplomas? How did you do it? Also, before you say anything, congratulations.
Thank you.
You did so well.
Thank you
and
so
also
much.
That walk, it's there in history. We'll never forget about it.
I would say that how I stay motivated is that I always remember why I started in the first place. I think this is actually what centers me every single day. On the days that I have really tough days at work, or I'm doing a call, or I'm really exhausted and I don't want to film or put on makeup and be in front of the camera, I remember why I started. And I think that that's actually what people need to sit with themselves with. So my journey was that I always knew that I wanted to do diplomas that really spoke to me. And as I said, I'm passionate about mental health, and I'm also passionate about HIV, because this is something that's really everywhere in South Africa. People might not know it, but if you work in government and you work with patients, you see it's really everywhere. So during my time in community service, I ensured that I, immersed myself in the rotations. I was in internal medicine for 6 months, as well as psychiatry for 6 months. For some reason, I didn't actually want to be in internal medicine, but I made the best of it because I thought to myself, I need to use this time and come out the best doctor that I can be. And internal medicine honestly does that. So I wrote my diplomas. The first one I applied for was actually the diploma in mental health, because it's 2 examinations.
Okay.
There's a written component as well as an oral examination. And I knew that that was going to be a lot of work to prepare for. And then the HIV diploma, I only did post-ComServe. So that was how I was able to do the 2 diplomas. I started the DMH in ComServe, and then I did the HIV diploma in the next year.
Yeah, okay.
Yes. And then in terms of just knowing or motivating yourself, I think that really leaning into your community is something I did. For the first time in my life, I was allowing myself to be vulnerable, because I think that as doctors, or just, I'm a firstborn daughter, you are taught to be the strong one. You're taught to be the one that is a leader, that is going to be successful. You're going to, you have to set an example for your siblings. And I just told myself, you know what? I am not holding on to that anymore. I am going through it. I'm struggling. And as you mentioned, my mental health definitely did plummet. But during that time, I always reminded myself that I will thank myself for the sacrifices I'm making today. Those nights when I was pushing through, burning the midnight oil, struggling. In fact, I almost deferred my HIV diploma exam. I thought I was not ready. I think it was 3 days before, and I was Googling, how do you defer writing the HIV diploma? And what I would need to pay for that, because I truly did not feel like I was good enough to go write that exam yet. And funnily enough, that was the one I actually got with distinction. And I think that it's just, once again, reminding yourself that you can do hard things. You can actually supersede your expectations.
Yeah.
Yes.
You can do hard things. You really can do hard things, And I think this concludes our conversation. I feel like there's still more that we can talk about. There's still other parts of mental health that we can talk about, and like also just getting to know who you are. I think we just scratched the surface, and you've been dropping bombs. Like, I think for me, if I was sitting there watching, I'll be thinking, hey, girl, you need to wake up and go work. You need to go form relationships. You need to go and just be vulnerable with people that are around you, right? Because those people are meant to carry you during that time when you feel weak. And being vulnerable is not a weakness. It's inviting people to carry you when you are feeling weak, right? Do you have any final remarks? And just to tell people where they can get you, if they have any further questions on like whatever you're doing or whatever they're interested, they want to ask you, where can they get you? People who want to reach out on social media, how do they get a hold of you?
I'll say my closing remarks are that always follow yourself and your most authentic inspiration. What I mean by that is I did not get here because I followed the traditional route of medicine. Yes, I'm still a working doctor in government, but I have listened to what my heart wants. And that has what led me to the opportunities that I get sometimes. And I'm very, very grateful, and obviously grateful to God for that opportunity as well. I think that people should really just sit with themselves, as I've said, and not follow what other people tell them is the right way. You know your way. A lot of the times you really, really actually do. You just are scared to take that chance. Take a chance on yourself and let's see what happens. That's my closing remark. People can find me on social media, on Instagram, TikTok, as well as YouTube as Dr Moratwe Masima, and also on my website, which is muratwemasima.com.
Thank you, Dr. Moratwe, for joining us on this episode. I really appreciated your presence. And unfortunately, this concludes our episode. And for those who are watching, thank you for joining us on this episode on the Doctor's Corner podcast. Thank you, and like, comment, and subscribe. If you have questions, put it on the comment section. And I hope you learned something. I hope we have changed your life. Someone gets to see the light of day because of the conversation that we had today. I hope we gave you hope. And thank you. I'm still your favorite village girl, Dr. Dakalo Ndouvhada.